Hi, mamas. Welcome to week 21 of our great pregnancy journey. I hope you're feeling well. I hope you're taking care of yourself. I hope you're also exercising and keeping fit in pregnancy, and that you've joined the Great Pregnancy Challenge, where every day there's a short 10, 15, 20-minute workout that you can incorporate in your daily life to make sure that you are taking care of yourself, of your growing and changing body, and therefore also taking care of the baby. Today, week 21, let's talk about what is happening to baby and mama, and we'll start with the baby. So the baby is around 27, 28 centimeters long and around 350 to 370 grams when it comes to the weight. So our baby is the size of a carrot. And these carrots are going through a lot of development currently. Especially when it comes to the brain is developing super fast. Taste buds are developing, and when your baby is now swallowing the amniotic fluid, they can taste what you've been eating. So the taste of the amniotic fluid is influenced by what you are eating. So make sure to have a diverse diet. Don't eat pizza every day. Do a lot of different cuisines, different vegetables, different meats, fish. Make it nutrient rich and super tasty. Go for different cuisines as well. So you can do Thai and Vietnamese and burgers and pizza, just so that your baby already gets to taste all of these amazing flavors. And this does impact and influence how they will be eating in the future. So it is really, really important. Their hearing is also developing rapidly. They can now hear your voice and recognize it, as well as different sounds that they hear on a daily basis. Their movements are more and more coordinated. So they're stretching and they're kicking and they're boxing and they're even making somersaults. They might also be grabbing different things. So they might grab the umbilical cord and pull at it. So like I mentioned, they are swallowing the amniotic fluid, and this also has an impact on their digestive system, which is also developing. So they're already training that system as well. Bone marrow has taken over when it comes to production of blood cells. Previously, this was done by the liver and the spleen, and now the bone marrow has taken over. So just like us grown-ups. Their skin is thickening, so it's becoming more complex. There are more layers, and it's starting to gain pigment. So previously it was completely translucent with a very, very thin layer only. Now that is changing. And the skin is also covered with a layer of lanugo, which is this fine hair covering the whole body of the baby, and it's protecting the baby and keeping the baby nice and warm. And another exciting thing is that their eyelids and eyebrows are forming. So if you go, or if you have been or will be going recently to the mid-pregnancy checkup, you will be able to already distinctly see the features of your baby. Super, super exciting. So this mid-pregnancy checkup that I just mentioned is a super, super important one. If you haven't done that yet, I guess you have it scheduled in the next days. It's a checkup where the doctor will measure and look into detail into all the organs of your baby, including the heart, the diaphragm. The lungs are not there yet. The liver and the kidneys. We'll check the length of the femur bone. So there'll be a lot of precise checks happening and taking place in this checkup to be sure that you feel comfortable with all the information that your doctor will be checking and giving you. I have created a PDF with some specific pointers for you that you can also ask and mention, so that you feel absolutely certain that everything is fine with your baby. So I just went for this checkup a few days ago. Very exciting, because now we found out that we have a baby boy. We didn't know until now, and the doctor asked, do we want to know? And we said, yes, of course, please. So she showed us on the ultrasound the area between the legs of the baby, and you could clearly, vividly see the penis and the testicles. So if you want to know, tell your doctor that yes, you want to know. But more importantly, if you don't want to know, tell them not to tell you. You hear all sorts of stories where parents don't want to know and don't tell the doctor that, and then suddenly the doctor's just analyzing everything and talking about everything, and also mentions the sex of the baby. So we are super excited. We have a girl that is 2 years old, and we're going to have a baby boy in 20-ish weeks. So that will be a great addition to our lovely family and this amazing journey of life. Let's put our parents away. We're going to talk about mama now. So what is happening to mama? You probably have an increased appetite. I know that I do. I've been eating more often and bigger portions, and that is normal. That is because your baby is growing, the support system around your baby is growing, and your body simply needs more energy. You might also be feeling heartburn and indigestion. So if you eat too big of a meal or too fast, you might be feeling some sort of heartburn or a slight reflux. So this is happening because the uterus is growing and is pressing on your stomach and causing these problems. So the solution to this is to eat smaller portions but more often, and be careful what you eat. So you might want to note down what causes this heartburn, and there are certain foods like very oily foods that might be impacting it more. So your hips will be growing, your breasts will be growing, your belly will be growing, and because of all this amazing growth, thank you to our babies, you might also be seeing stretch marks around these areas. So around the hips, the belly, and the breasts. Moisturize your skin, hydrate, definitely drink a lot of water. But unfortunately, genes also play a very big role here. So if your mom had stretch marks after pregnancy and giving birth, then it is probable that you will have them. If your mom didn't have them, then it is probable that you will not have them. When it comes to, so we say that the baby's growing, of course, the belly's growing, and because of that also, you might be experiencing this round ligament pain. So this has probably been around on and off since a few weeks now. As well as some backaches. And this is because the center of gravity is shifting, is changing, and we have to be more mindful about our posture and making sure that we strengthen the right muscles to support this growing belly and the shifting center of gravity. Something that you might start experiencing or might have already experienced is called Braxton Hicks. These are test contractions. So this is your body preparing for birth already. It could already start happening now. If you are training too intensively or too much, you might experience and feel these Braxton Hicks. This is also your body telling you to slow down a little bit and wait. If you are dehydrated, you might be experiencing the Braxton Hicks. That means you are not drinking enough and that you need to drink more water. So when you do start feeling some contractions around this area, have a think when it is taking place and whether there is a solution to this, or whether it is just something that is happening even if you are drinking a lot and not exercising too intensively, and it is still happening, that this is something just normal. Make sure that it doesn't happen too often and all the time. And if it does, then go to your doctor and tell them about it. They might want to check your cervix, how long it is, and to see whether something needs to be done to essentially keep baby in for longer. One last thing that you might be experiencing is mild swelling. So especially at the end of the day, you might be experiencing some swelling in your feet, in your legs, and in your hands. So there is one thing that you could try. that might help with the swelling, and these are compression stockings. So not just socks, not like ankle, knee-high socks, but complete stockings. These will compress your legs and will help with the circulation. And this will also help to press out any extra water that your body might be gathering. So this is it for week 21. I hope that I will see you in the next videos, in the training videos, as well as the update in week 22. Thank you for watching this one and have a great day. Bye.